Okay, today we're going to do monitoring pulse oximetry. So the first thing we need to do is we need to go look at our doctor's orders, and we have to check to see if there's any isolation precaution for a patient because we can't go in the room with that. Then we're going to gather our equipment. We're going to need a nail polish remover pad if they have nail polish on. We're going to need an alcohol wipe to clean the finger, and we're going to need a pulse oximeter. So the first thing I'm going to do is I'm going to wash my hands. And I'm going to get ready to go into my room, and I'm going to knock on the door and introduce myself to the patient. Hi, good afternoon. My name is Mrs. Kyle, and I'll be your nurse today. Can you please give me your name and date of birth? Okay. Mr. Pierce. Matching the armband with the patient, and date of birth 10/3/1960. Okay, Mr. Pierce, I'm here to take your oxygen saturation, and that's to see how much percent of oxygen is in your blood. So the next thing I would do is I would make sure that I put the bed to working height so I can take care of the patient. Now there's certain things I need to assess before. I need to figure out, does the patient have heart or pulmonary disease? Or has he had anesthesia or ventilator dependent? And also, does he have a low hemoglobin level or confusion? Or decreased level of conscious or respiratory stress? These are actually indicators that determine that the patient has oxygenation problems, and they might have pulmonary disease, which will cause O2 saturation to be lower. Also, we want to assess, before we do this, we want to assess the patient's respiratory status that you learned in health assessment to check the breath sounds anterior and posterior and laterally. And also we're going to look at the respiratory rate, depth, and pattern to check on, see how the tissue perfusion is going. We're going to look at a patient's lips and also the mucous membranes and the nail bed color. Because all these things, if the nail bed color is blue and their lips look blue and cyanotic in color, that means the patient has a decrease in O2 saturation. Also, we're going to determine the optimal level for to do the oximeter. This particular oximeter that I have is actually a fingertip oximeter. They make ones that go on the earlobe, and they also go on the forehead or the bridge of the nose, but this is for a fingertip that's most commonly used. So I'm going to start out by checking the capillary refill next to the patient's, where I'm going to take the pulse ox, because we're going to make sure that we have good blood flow, because you need good blood flow before be able to take the O2 saturation. And also we're going to make sure the patient's free of artificial nails. There's no nail polish, because if they have decreased oxygen saturation, that the nail polish won't be actually will hinder the reading. We also need to assess for factors that affect pulse oximetry. One of them being anybody that has low temperature, what we call hypothermia. Also hypotension, because they don't get good blood flow, and it will cause inaccurate readings. And if the patient has tremors, it will show up as artifact and they won't get good reading and stuff. So the patient needs to have accurate circulation to be able to, for the hemoglobin to be able to absorb the light, emitted light, to be able to get a proper reading. We also, if we're using one that is actually one that has adhesive on it, we make sure the patient doesn't have adhesive allergies. Okay, so now we choose appropriate sensor because we're going to do a fingertip reading. I'm going to first start out by cleaning the patient's finger. So when I clean the finger, I want to make sure it dries thoroughly, because we want to prevent the spread of microorganisms. Also, it helps remove moisture, and also we want to make sure we remove any nail polish, because if the patient has nail polish on, it may interfere with the reading, so we want to do that too as well. And it interferes with the signal. Okay, so now I'm going to put on the pulse oximeter. I'm going to make sure this has a couple diodes in here. The diodes need to be lined up. I'm going to put the Now that it's dry, I'm going to put this on the patient's finger. And it usually takes anywhere from 60 seconds to 2 minutes. And so when they do the 60 seconds to 2 minutes, then what happens, it will pick up a reading. Now we want to make sure that we read the measurement on the tray, so anywhere the normal reading for mostly is 95 to 100%. The other thing is we never want to use the pulse that's on here, because if we use the pulse that's actually reading on here, a lot of times these are inaccurate. You should always take a manual pulse when you're doing the oximeter. We also want to make sure that we obtain the reading. If we have somebody that has some irregular respirations, we definitely want to take a pulse oximetry. And when it's no longer needed, we're going to remove the oximeter from the finger. We also want to make sure that we demonstrate this for the caregiver if you're having to do this at home, and also teach them the significance of the results. Now, SaO2 readings, like I said, mostly is 95 to 100%. That's normal, healthy adult. Sometimes elderly read anywhere from 90 to 92%. I've seen that. But doctors a lot of times will write orders for anything from, may keep O2 sat for 93%. So that's 93%. And we want to make sure that we check the patient for any signs and symptoms of hypoxia, which includes confusions, restlessness, shortness of breath, dyspnea, cyanosis, and somnolence. Okay. Mr. Pierce, did you understand what we were doing today? Okay. And we're going to make sure we compare the results, what we got there with the pulse oximeter, to how the patient's status is. And we're going to check his status the whole time when we're doing the reading, before, during, and after. If it's an adhesive probe and we need to leave it on a long period of time, we're going to make sure we alternate it, because they can develop an allergy. And also, if you have a clip one, like if it's a continuous monitoring, we want to make sure that we rotate the site, because the patient's skin can break down with the clip too long. Okay, Mr. Pierce, are you having any pain, anxiety, or anything like that, or any shortness of breath? Okay. So now what we're going to do, since we're finished, we're going to put the bed down in low position. Make sure the patient's top 2 rails are up and he's in perfect alignment in bed. We also want to make sure that we put the call light in reach. Mr. Pierce, if you need anything, make sure you push the button, give me a call. And we're going to make sure we dispose of any equipment that we need to use, that we used. And we're going to put this away. And we're going to make sure that we wash our hands before leaving the room. And any abnormals we're going to report to the nurse instructor. Now, when we go to document, we're going to make sure we document on the flow sheet where it says, under vital signs, where it says SaO2 rating. So we're going to put the percentage, and the patient doesn't have oxygen, so we consider that as room air, so we put RA for room air, and it was 99% oxygen. Okay. And we're also going to make sure that we document the date and time that we did the reading, and any vital signs if we needed to. Look at the vital signs, and we also, if they were in oxygen, we record what the percentage of oxygen they're receiving, or how many liters per minute, and also what type of device that's being delivered the oxygen. If there's any problems with decrease in SaO2, we need to document anything that that looks like labored respirations, problems with capillary refills, cyanosis, or anything like that. And also we're going to document what we did for that if we had to put them on oxygen, and in the response if the O2 saturation came up.